President Trump saying we are in the midst of a very difficult week, as he says the U.S. may be getting to the top of the curve. This is the death toll in the United States now tops 12,000. Confirmed cases are now approaching 400,000. We're at now more than 387,000 to be specific. And there are new numbers out of New York and New Jersey today confirming the deadliest day there and the number of reported deaths for both states. In New York so far, and this number has changed even over the past hour, 806 people have died. And while there are still major challenges ahead, the director of the CDC is actually now saying the U.S. death toll could be much lower than the 200,000 that he originally predicted. Erica Hill is out front in New York. And Erica, they've talked a lot about this model, right? And this is the model that has been used to justify actions taken across this country, dramatic actions about the possible death toll. And today they say they're revising that sharply downward.
Yeah, and that certainly had a number of people sitting up and paying attention. Obviously, anybody would like to see that number revised downward. But what's perhaps most interesting was the reason that was given for that. And it's pretty simple. Americans are listening to these very important orders to stay home.
With about 97% of the country now under stay-at-home orders, new evidence it may be working.
The numbers are going to be much lower than would have been predicted by the models.
The director of the CDC saying the U.S. death toll could be far lower than previous projections of 200,000, thanks to widespread social distancing, which models had initially estimated just 50% of the American public would follow. The reality today is much higher, though officials caution this is no time to ease up. On Monday, New York logging the state's largest single-day death toll. One overwhelmed funeral home doing its best to meet the need.
We're no longer embalming them.
Why is that?
Just because we don't have time to have visitations. We're simply either burying directly or direct cremation.
Healthcare workers continuing to sound the alarm about personal protective equipment. In Maryland, one nurse practitioner tried making a face shield out of a page protector and a headband.
I put it on and I started crying. And I thought, I can't imagine anybody wearing something like that.
Staff also a major concern. Retired nurses and doctors answering the call to help relieve those on the front lines.
I've never seen emergency departments or nursing or any of the services actually in general under so much threat. And, it's a family. So when family is threatened, you try to step up as much as you can.
On board the Comfort, which will now be dedicated to COVID patients, the number of beds cut in half to 500 for safety. One crew member has tested positive. Meantime, in Florida, this tightly packed line for unemployment forms, a sobering picture of the growing need.
Everybody out here is risking their lives to get this application.
We've given out hundreds and hundreds of applications.
In Connecticut, unemployment applications are about 20 times higher than anything the state's seen during a recession. Wisconsin voters on Tuesday trying to keep their distance at the polls, as one of the nation's largest grocery chains announces new restrictions on capacity amid concerns about how and where the virus is spreading. In Miami Beach, face coverings now required for all customers and employees at grocery stores, pharmacies, and restaurants, including those making deliveries.
And Aaron, just to give you a sense of where we're at, we talked about the highest single day for deaths on Monday in New York State. We heard from the governor. In New York City, 806 new deaths reported today. That is triple the number of new deaths that were reported on Monday. And when we look to where some of those numbers are coming from, we also learned from the NYPD today, Aaron, the 13th coronavirus-related death there.
All right, Erica, thank you very much. And out front tonight, Dr. Sanjay Gupta. And Sanjay, a lot to talk about from this briefing. I want to get that the president just wrapped up a few moments ago, his part in it. I want to ask you specifically again about this drug. He brings it up again, hydroxychloroquine. And in this case, he emphasized twice that he wasn't a doctor, but he continued to say that he would try it. And he specifically also said that you're not going to die from it. And he gave a whole story about a woman that he said was a Democrat, an African American, and now trusts him because he said this about the drug, and she took it, and 4 hours later, it was like a miracle. He said she was better. What's your reaction to that, what he said?
You know, Aaron, I think everybody, as we've talked about before, in the world wants a drug to work, wants a medication that can work, because we're in the midst of a pandemic, something that most people alive really haven't been through before. That's not evidence, what he's talking about. It simply isn't evidence. And, you know, it's not even a question of being a doctor at this point. I mean, doctors may have some ideas in terms of why a certain medication may work, why it wouldn't work, who should get it, who shouldn't get it. But the reality is that we don't know right now. That is why it needs to be trialed. There are concerns about just sort of giving medications without evidence. There could be potential problems. I'll give you an example. You know, with this particular medication, it may be working in part by suppressing the immune system. Okay? In somebody who already has a weakened immune system, that could be a problem to give a medication like that. In someone who has an overreactive immune system, maybe a medication like that would be a good choice, but we don't know. We don't know the dosing, we don't know the duration, we don't know at what stage someone should get these types of medications. I think what I was really concerned about, Aaron, besides the stories being used as evidence, is the medication being trialed right now? We keep hearing that millions of doses have come to, you know, places like New York City. Are they just being given without being studied? Because that would be a real problem. You know, in the end, what might end up happening is a potentially legitimate medication. We may never collect the data and be able to responsibly apply it to people who could really benefit from it. So not only it's dangerous for lots of different reasons, dangerous potentially to patients, but dangerous to the public because we may be losing out here on something that's valuable.
And of course, you know, we do know it can also cause damage to heart damage, liver damage. I mean, there are side effects, as you point out, for certain individuals. The president, though, didn't just give that one example. He then also said that hydroxychloroquine is good for hospital workers, to take. And, you know, his words, I believe here, I jotted it down, were, it keeps it out of your system, which is a pretty direct way of saying if you take this stuff, somehow it's going to prevent you from getting the virus. Is there any truth to that?
Not that I've heard. You know, essentially describing this as a prophylactic, it sounds like, you know, to take it prophylactically. You know, it's interesting because if you look at the trials, like there was a study that came out of China, 62 patients, you know, small study, Aaron, something that we would never even report on CNN because it's not at that level of evidence yet. But in those patients, it was given to patients who had mild disease. Now, thankfully, most patients with mild disease don't progress to serious or critical illness. You know, I mean, 80% of people, you know, recover from this illness, and maybe the numbers are even higher as we do more testing. So how do you know whether it was the medicine or whether it was just natural history of someone's own, you know, fighting the disease? You don't know, and so now you're potentially subjecting people to a risk, not knowing whether the medication actually helps. And just quickly, Aaron, in that study, they also excluded patients who had any kind of heart rhythm problem, liver problems, or kidney dysfunction as well, because they were concerned about side effects, even in a small study like that. Again, that's why we do the trials. It isn't a question of being a doctor. I don't know the answer. I'm a doctor. I don't know the answer right now. Nobody does. That's why you have to do the studies.
Right. And of course, you know, one thing we do know from interviewing, you know, many people is that, you know, at least up to this point, when that drug is given, they were also giving other things as well, right? Everything they could to try to help. So it's very difficult to say if it was any of, none of, or just getting better on its own. I mean, it's very hard to say. So in New York, which obviously has been the epicenter, and I know obviously you have a lot of places in the country, DC metro area, where now, you know, the growth rates are really ramping up. But in New York, you had a new one-day high in deaths. You heard Erica mention 806 people died in New York today, but hospitalizations are slowing. How much do you read into that?
I think it's significant potentially, and I think it's hopeful. I mean, you know, you want to see these trends continue, but it's important to keep in mind that, you know, the picture we're seeing right now in New York and really everywhere that's doing ramping up testing is still sort of a lagged picture, because, you know, between the time someone is exposed to the virus to the time they might get tested, to the time that they might actually end up in the hospital, if they have to go to the hospital, you know, you're starting to talk about a couple, 3 weeks. So you're really looking at a picture from a couple, 3 weeks ago. But if hospitalizations are slowing now, then in 10, 11 days, should deaths slow down as a result of that? I think that's a reasonable sort of thing to think. We want to see that trend continue, but I think it is hopeful. And also, even though the number of deaths go up, the fact that the pace at which the number of people dying is starting to slow, I think that's also hopeful. But again, you want to see that continue.